I'm Dr. Katie Passaretti. I'm the medical director for infection prevention at Atrium Health in Charlotte, North Carolina. So I'm kind of the subject matter expert in the hospital and healthcare system's response to COVID. So I help with as we learn more about this infection, how do we control the spread in the hospital and the community? What do we need to change? How do we protect and treat the patients as we learn more and new treatments become available? Ebola and MERS and COVID are all very different types of infections, types of viruses. My role is very similar in what I do as it relates to those viruses, but each individual situation is different and frightening in its own way. So Ebola and MERS were very devastating as to the individual who was infected, but we were able to contain those viruses from spreading within our communities. COVID is not as deadly to the individual person as Ebola or MERS, but obviously we have been much less successful in controlling the spread. COVID can spread very easily out in the community and even from people before they know they have symptoms or without symptoms at all. So because COVID can spread in that way, it really requires a community response to control the spread. It can't just be hospitals focusing on the sickest of the sick to prevent spread. It has to be in the community. Even when we have mild symptoms, things like masking when we're around other people, staying home when we're sick are so important to controlling the spread of COVID. So one of the things about COVID that's really kind of disturbing and, an area of big focus is that COVID disproportionately affects people who are underserved in medical communities in other ways. So African Americans, Hispanic individuals, lower income individuals are disproportionately affected. We have for sure learned along the way the science of the virus, so different ways to control it, what's the best way to prevent spread, to treat patients, but even more so the impact of human behavior on controls. There was initially a ton of fear, a ton of attention, a lot of focus put on social distancing, coming from even, governmental bodies and whatnot. Over time, as people realize this is a marathon, not a sprint, there's been a lot of fatigue. So keeping up that level of, attention to what needs to be done to control spread is hard to do for really long periods of time. I think especially in younger populations, there's a sense that, if I get this, it's a cold, I don't have to worry about it, or, so what, I get sick, I'm, don't feel good for 5 days and then I'm better, who cares? I think I underestimated the impact on emotions, the science and the spread and all of that is stuff you learn about in school. I think actually dealing with healthcare providers that are scared to go home, that are scared to wear their dirty scrubs at home and have to strip in their garages because they're worried about their children getting sick. Seeing our healthcare workers trying to take care of patients and at times getting sick themselves, that's very emotional for me, seeing the consequences of that, seeing, healthcare workers, and this is also true for Ebola, the passion and, the willingness to put self at risk to do what's best for patients amongst healthcare workers. That gives me hope, but also, it's the most emotional thing. I do think with some changes in behavior that we can change the curve on this and, do help a lot of people. So, it's not hopeless. There's a lot of hope that can be found in people's response and the people that are doing work in hospitals and communities to try to prevent spread and, try to focus on the Mr. Rogers model. Look for the people that are running into the fire, trying to do good. It's always important to recognize that.